When I was 14, my mom almost died, and I didn't have very many options. It was either stay home and take care of your mom or go to school and let her die. And I chose to take care of her. I tried to go back a couple times, and every time I got back into school, she got sick, and I just quit. I would quit going. I'd try again, she'd get sick. So I kind of just got to the point where I was like, all right, I'm just gonna focus on her and I'll worry about me later. I went through a lot of depression. I used to isolate myself. Like even my best friends I wouldn't talk to. There was a time where I went 3 months without talking to anybody. Even at my house, I still made sure everything was fine with my mom, and I would come out and shower at night when everybody was asleep. And I'd go back in my room.
Sylvia was really discouraged. She'd been into the office time and time again. Her pain was bad, and her depression was really bad, and she was just kind of maintaining that depression level. So when I met her, she was at a really low state. She didn't have a lot of family support. She didn't have a lot of financial support. Because she has the big heart that she does, she was taking care of her mom and sacrificed a lot of her life to take care of her family and be there for her family.
When I first met Chelsea, it was kind of hard to accept how genuine that she was and how much she really cared, and the fact that she wanted to go out of her way and help me, something just unfamiliar, and that support is something I had been missing for a while.
A lot of the times it was just listening to her because she didn't have support. She didn't have people to be there for her. So it was just listening and having her vent to me or cry to me or be frustrated with her situation. And then after a while, it turned into some motivation and support that if you did try, we would be here for you. If you did try, we might have supports for you. If you did try, I have a great community health worker that's willing to sit down with you and see what she can do with you and get you some services and support.
She knew what she wanted to do. She had her goals set up for her. She just needed that, extra support, that push there to just help her navigate through the things that she wants to do. She was taking care of her mom, and she didn't have any income coming into the house. So I actually set her up with an agency so she can actually get a little bit of income while taking care of her mom. And just being a resource for her if she needed anything or if she had any questions.
I've done more for myself this past 6 months than I have the past 10 years. I went back to school. I not only finished my GED, but I did the 15-week healthcare class and got lots of skills and certifications from that. I did my driver's license. I got a car, so I don't have to pay people gas money to get everywhere anymore. I went and did my CNA. I did a 2-week class for that. Like Chelsea really goes above and beyond. And I've never had nobody go out of their way for me the way she does, especially not expecting anything in return. They just gave me that push that I really needed. And they didn't just give me that push and leave me to be on my way by myself. Like, they stayed there. For the first time, I'm proud of myself, which is an even better feeling.